with the latest picture of this illness that's spreading fast. Dr. Owen Kalua is with us to help us understand some of the main issues. Dr. Kalua, very good morning, and thank you very much for your time here on ENCA. First up, can I just ask you at an overriding level, the warning coming from World Health Organization that the threat of coronavirus becoming a pandemic is now very real. What does this mean?
Well, as you know, that at first we're dealing mostly with this outbreak within China. After that, a number of countries began to have cases, and the number of countries that is having cases is now increasing quite a lot. At the moment, there are about 104 countries that have reported cases outside China. And the rate at which it is spreading is the basis for raising the alarm. But the most important thing to note is that we still have a window of opportunity. If countries can put addressing coronavirus as a priority to ensure that preparedness measures are there to be able to identify, detect any cases, and be able to follow up all the contacts in a robust manner, so that all cases that are confirmed can be given the necessary care and the necessary support while reinforcing the measures to contain the coronavirus. So we believe that we still have an opportunity to roll back, but it requires the action of all stakeholders. It requires also at individual level for individuals to adopt the lifestyles in terms of the cough hygiene, the hand hygiene, and all the other measures that have been explained, so that together we can be able to slow down and even reverse the trends regarding coronavirus.
Now, from what's happening in Italy as an example, what lessons can the rest of Europe and the rest of the world take from that? I mean, the whole country, for the first time, has been locked down.
Well, I think the various measures that countries can take, they take according to the assessment that they have made locally and what are the measures that they need to take. What is important is for WHO is giving out the evidence-based or scientifically based evidence that shows what is it that we need to be doing. And based on that, a number of countries are adopting a number of measures to try to address the various outbreaks that they are experiencing. But I think what is important is to really prioritize the addressing of coronavirus and to have a lot of vigilance in dealing with it.
Now, prioritizing, what would it mean? I mean, we know, as you said, there has to be a certain level, degree of preparedness that a country must have. If it is to become a priority, that means deploying all necessary resources for prevention, detection, and treatment of cases.
Absolutely. It means putting the resources that are required to mount a comprehensive response in terms of prevention, identification, as well as in terms of care for those who are affected. At the same time, you know, addressing coronavirus requires action beyond just the health sector or the ministries of health. It requires the involvement of other sectors. So bringing about priority means engaging all the other sectors that are necessary, that can add value to the response against coronavirus. So it requires a whole government approach in dealing with it.
Is WHO satisfied from what you are seeing at the moment, for example, here in Africa, where we know that public health systems are under a lot of pressure due to other challenges? I mean, you name a number of diseases that our continent in Africa is currently facing, from malaria, HIV, AIDS, TB, pneumonia, and all kinds of other challenges. Public health systems not coping. Is WHO satisfied that Africa is doing enough to be prepared to deal with coronavirus?
Since we had the news of the outbreak and since it has been spreading, WHO has been working with all the member states, including the member states within Africa, to strengthen their preparedness. And this has involved providing the necessary guidance of what needs to be done. We know for sure that health systems in Africa are not as strong. We know for sure that resources are not always adequate. That's why, after the declaration of public health emergency of international concern by the Director General of WHO, it called for global solidarity, so that there should be support for countries that may not have all the resources also to respond. So a number of international institutions, including IMF, including World Bank, and many others, have come forward to indicate that they are ready to provide support and strengthen systems. So us as WHO will continue to work with them, provide the necessary evidence of interventions that work, and then support the work that Africa is doing. When the outbreak started, there was very limited capacity in Africa, for example, to be able to test and confirm coronavirus. Now we have over 30-something laboratories that are able to do that. So the work of building the systems for readiness is an incremental work. And at the same time, we're taking advantage of what was already built from the previous outbreaks that we have had. So yes, no country can be foolproof. Yes, we continue to work on it, but we're taking it forward, knowing that we'll be able to go a long way to help the countries in their ability to prevent, detect, and deal with coronavirus.
Thank you very much, Dr. Owen Kalua from the World Health Organization there, the WHO calling on governments to prioritize everything around the coronavirus.